Is your shoulder popping, slipping, or just not feeling right? Today, I'll show you how we fix shoulder instability naturally without surgery by strengthening your body's natural support systems. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health using cutting-edge evidence-based treatments. Today we're tackling shoulder instability, why it happens, what structures are involved, and how we treat it using regenerative medicine principles. We'll talk about prolotherapy as a foundational concept, explore biotensegrity, and explain how healing and strengthening build over time. So what is shoulder instability? Shoulder instability happens when the ball and socket of the shoulder are not securely locking together, allowing the shoulder to slide, shift, or even dislocate. Because the shoulder prioritizes mobility over stability, it depends heavily on the soft tissues around it for proper support. So what structures are involved? You have the labrum, which is a cartilage ring that deepens and stabilizes the socket. You have ligaments that connect bones and limit excessive motion. You have rotator cuff muscles and tendons that dynamically stabilize the shoulder during movement. And you have the shoulder capsule, which creates a sealed, supportive environment for the joint. When any of these tissues are stretched, torn, or weakened, the shoulder can become unstable. So what causes shoulder instability? A few things. Trauma. Falls, collisions, or forceful dislocation can cause damage to those supportive structures, leading to instability. Repetitive overuse, such as from overhead sports like baseball, swimming, or volleyball, or if you do work where your hands are above your head and you're constantly stressing the shoulders, it can lead to progressive stress on the ligaments or tendons that then leads to instability. And then there's some folks who just have genetic laxity, where they're naturally looser ligaments, making them more prone to instability. And then there's muscle weakness or dysfunction. Poor control by the muscles allows excessive joint movement as well. Symptoms of shoulder instability include the following: looseness or a slipping sensation, pain, especially with overhead motion, weakness, clicking, popping, or grinding, or at its most severe extent, recurrent dislocations. Accurate diagnosis is key to developing the right treatment plan here. First off, a detailed history and physical exam. We start by listening closely to your symptoms, injury history, and activity level, and then using specific manual tests on examination to assess force stability in the shoulder. Next is musculoskeletal ultrasound. Here at Chicago Arthritis and Regenerative Medicine, we routinely utilize ultrasound to dynamically evaluate the shoulder in real time. This allows us to see soft tissue structures like tendons, ligaments, and the joint capsule while you move your arm. Ultrasound is a powerful tool because it's safe, non-invasive, and lets us detect small injuries that sometimes MRI can actually miss, especially early instability or partial tears. MRI and X-rays are frequently also done. X-rays help to rule out fractures or other types of bone pathology. MRI is helpful when we need to take a deeper look at the labrum, cartilage, and deeper structures within the joint as well. But often combining expert physical examination with dynamic ultrasound evaluation gives us the clearest picture to guide your treatment. Next, how do we actually treat your shoulder instability? Our goal is to restore function and stability naturally, strengthening your body's own support systems. Start by focused strengthening, rotator cuff and scapular muscles with physical therapy to help out with that. Then there's movement retraining, teaching efficient protective movement patterns. Activity modification may need to be done, adjusting your activities to support healing as well. When structural tissues need extra help to recover, we then do utilize regenerative treatments based on some very key foundational principles, which I'll discuss. Prolotherapy is a cornerstone of regenerative medicine. It's not just a technique, it's a foundational principle here. The concept is that we're stimulating your body's innate ability to heal and strengthen. Prolotherapy involves injecting a natural solution into weakened ligaments and capsules. This triggers a local healing response, encouraging new, stronger collagen formation. Over time, these tissues become thicker and tighter, restoring mechanical stability. Think of it like we're reinforcing the walls of a house, making your shoulder resilient again. Prolotherapy treats the root cause of instability by restoring the tension in these structures without the downsides of surgical cutting or tissue destruction. The next concept to understand is biotensegrity. This is the real secret to real stability. To understand true healing, you need to know about biotensegrity. Biotensegrity explains how joints maintain structure and stability through a balance of tension and compression. The tissues involved include ligaments, tendons, and muscles, which create tension, and bones that provide compression. When tension structure weakens, the system loses its integrity and instability develops. Our regenerative approach restores proper tension across the shoulder, rebuilding a stable, resilient framework that holds strong even under stress. So biotensegrity comes from this concept in architecture called tensegrity. What it means is that if you have individual structures that are weak on their own, if you put them in close approximation and then under compression, you now have an overall structure that is stronger than its individual parts. This concept in biology and in medicine is called biotensegrity. Now, real healing takes time and patience. Ligament and tendon remodeling after treatment takes months. Muscle retraining demands consistent effort and correct guidance. Each treatment cycle builds a little more strength with a little bit more stability. We track your progress over time, measuring improvements in strength, movement, and stability at each step. This methodical, steady improvement results in true long-term recovery, not just temporary symptom relief. In cases needing even greater regenerative support, we utilize stronger orthobiologics. Orthobiologics are the cells that we use from your own body to treat musculoskeletal issues. Platelet-rich plasma, or PRP, is the first-line one. PRP concentrates healing platelets from your own blood, delivering growth factors that accelerate tissue repair. Bone marrow concentrate is the next one that contains regenerative cells, including stem cells and other growth factors that help to rebuild damaged ligaments, tendons, and cartilage. PRP and bone marrow concentrate are incredibly powerful when treating more severe instability or when prolotherapy alone is not enough. At Chicago Arthritis and Regenerative Medicine, we personalize your regenerative treatments based on your specific needs and goals. Let's discuss some common misconceptions about shoulder instability. Number one is that rest alone will fix it. That's not correct. Without properly guided strengthening and, if needed, regenerative repair, instability often worsens. Misconception number two, surgery is the only solution. That is false. Most shoulder instability can be resolved non-surgically using regenerative techniques. In some cases, where there is more advanced or severe instability, surgery may be required. Misconception number three is that popping always means dislocation. That's not necessarily true. Popping can come from minor soft tissue changes in the ligaments and tendons and does not always mean a serious injury such as a dislocation. Hey, some key takeaways from our talk today. Shoulder instability results from weakened stabilizing structures. Regenerative medicine, starting with prolotherapy as a foundational concept, restores natural strength and stability. Musculoskeletal ultrasound is a critical diagnostic tool for precise evaluation. Healing takes time, but builds stronger, more resilient shoulder function over time. And orthobiologics, like PRP and bone marrow concentrate, are additional regenerative options when needed. If you found this helpful, please make sure to like, subscribe, and check out chicagoarthritis.com for more expert advice on living pain-free and strong. If you're dealing with shoulder instability, we can help you heal naturally, rebuild confidence, and get back to the activities you love. Thank you for watching, and live well.